Welcome. Today we're diving deep into a rare congenital heart defect called Triatriatum. Imagine a heart with an extra chamber in its left atrium. It's a structural abnormality that, while uncommon, can significantly impact blood flow and overall heart function. Join us as we explore the ins and outs of this fascinating condition. The exact cause of Triatriatum remains somewhat of a mystery. It's generally considered a congenital defect, meaning it's present at birth. The prevailing theory revolves around incomplete incorporation of the common pulmonary vein into the left atrium during fetal development. Instead of the vein seamlessly integrating, a membrane or septum persists, dividing the left atrium into two chambers. Genetic factors are also suspected to play a role, but more research is needed to fully understand the underlying genetic mechanisms. Now let's understand how Triatriatum impacts the heart. Imagine the left atrium normally receiving oxygen, rich blood from the lungs via the pulmonary veins. In Triatriatum, a dividing membrane obstructs this flow. The pulmonary veins drain into the accessory, or upper chamber, and blood must then pass through an opening in the membrane to reach the true, lower left atrium and subsequently the mitral valve. The severity of the obstruction depends on the size of this opening. A small opening restricts blood flow, leading to pulmonary hypertension, increased pressure in the lungs, and ultimately heart failure. The accessory chamber becomes dilated due to the increased pressure, and the left ventricle may struggle to fill adequately, reducing the amount of oxygenated blood pumped to the body. Triatriatum is a relatively rare condition, occurring in approximately 0.1% to 0.4% of all congenital heart defects. It's observed in both males and females, and there's no known significant geographical predisposition. Due to its rarity, accurate epidemiological data can be challenging to obtain and many cases may go undiagnosed, especially in mild forms. The signs and symptoms of Triatriatum can vary widely depending on the severity of the obstruction. Some individuals with a small opening in the membrane may be asymptomatic for years, while others, particularly infants, can present with severe symptoms early in life. Common symptoms include shortness of breath, especially with exertion, fatigue and weakness, rapid breathing, poor feeding in infants, bluish discoloration of the skin, lips, or nails, known as cyanosis, and in severe cases, heart failure. Older children and adults might experience symptoms similar to mitral stenosis, such as palpitations, chest pain, and dizziness. Diagnosing Triatriatum typically involves a combination of non-invasive and invasive techniques. A thorough physical examination and review of medical history are crucial first steps. An echocardiogram, which uses sound waves to create images of the heart, is usually the primary diagnostic tool. It can visualize the dividing membrane and assess the degree of obstruction. Other diagnostic tests may include chest X-rays to evaluate the size and shape of the heart and lungs, electrocardiograms, ECGs to assess the heart's electrical activity, and cardiac catheterization. Cardiac catheterization, an invasive procedure, allows direct measurement of pressures within the heart chambers and can provide detailed information about the size and location of the obstruction. Increasingly, advanced imaging techniques such as cardiac MRI and CT scans are used to provide more precise anatomical details. While traditionally classifications haven't been a primary focus, Triatriatum can be broadly categorized based on the size and location of the fenestration, or opening, in the dividing membrane. A large fenestration causes minimal obstruction, while a small fenestration results in significant obstruction and more pronounced symptoms. Another way to categorize them is by the presence or absence of associated heart defects. Triatriatum is often found in conjunction with other congenital heart abnormalities, which can complicate diagnosis and treatment. The treatment of Triatriatum primarily focuses on relieving the obstruction caused by the dividing membrane. For symptomatic individuals, surgical intervention is usually necessary. The standard procedure involves surgically excising or resecting the membrane, creating a single, unobstructed left atrial chamber. This can be performed through open heart surgery, and increasingly, minimally invasive approaches are being explored. In some cases, particularly when the opening is small and located favorably, a catheter-based intervention may be possible. This involves using a balloon catheter to dilate the opening in the membrane. Medical management, such as diuretics and medications to manage heart failure, may be used to alleviate symptoms before surgery, or in cases where surgery is not immediately feasible. As a congenital heart defect, Triatriatum is not preventable in the traditional sense. Since the exact etiology is not fully understood, there are no specific preventative measures known. However, women planning to become pregnant can optimize their health by avoiding smoking, excessive alcohol consumption, and certain medications known to increase the risk of congenital heart defects. Genetic counseling may be beneficial for families with a history of congenital heart disease. The prognosis for individuals with core triatriatum is generally excellent following successful surgical correction. Early diagnosis and prompt intervention are crucial to prevent irreversible pulmonary hypertension and heart failure. After surgery, most patients experience significant improvement in symptoms and quality of life. Long-term follow-up is necessary to monitor heart function and detect any potential complications. Recent research is focusing on refining minimally invasive surgical techniques and improving diagnostic imaging for more precise anatomical assessment. Additionally, genetic studies are underway to better understand the underlying genetic factors that contribute to the development of core triatriatum. With continued advancements in diagnosis and treatment, the outlook for individuals with core triatriatum continues to improve.